Good morning, everyone.
Morning.
Thank you for being here today. First, I'm going to welcome some of our dignitaries that are here today. So first, to my left, Senator Menendez, thank you for being here. Congressman Payne, thank you for being here. Dr. Bleich, who's our Division Chief of Endocrinology, thank you for being here. We have one of our patients here. Thank you for being here. And then Kathy, I saw Kathy. Kathy, thank you for being here as well. Kathy is the Executive Director of the New Jersey Advocates for Aging Well. My name is Ed Jimenez, and I am the President and CEO of University Hospital. Chronic illnesses like diabetes, we all know, are issues. And in particular, in communities like ours, they can have a dramatic impact. 16% of Newark residents are diabetic. And that represents a burden on folks. And when we did a community health needs assessment in 2021, one of the things we learned is that folks with chronic illnesses feel an additional financial stressor to what, for some people, is already a complicated socioeconomic set of challenges. And so when you put those things together, you create uncertainty, you create tons of stress. And for us, we try to be solution-oriented. We've partnered in the past with JDRF. It's a foundation that does great things for type 1 diabetics, and they've helped us bring free screening programs to our community. But there's more that can be done, because quite honestly, none of us ever want to be in a situation where we learn of a person making a choice between dinner and their medication, paying the electricity bill and their medication. And so what the senator's here to talk about today, we find as a welcome and important step for our community. It will absolutely alleviate for seniors in our community a stressor. And so I am thankful that the senator's here. I'm appreciative. On behalf of the City of Newark and University Hospital, welcome Senator Menendez.
Thank you. Thank you very much. Thank you very much for the gracious welcome. Good morning, everyone. It's great to be back in Newark and here at University Hospital as we come together to talk about historic cost reductions for insulin patients in our state and across the country. I'm especially honored to be joined by my colleague, Representative Donald Payne, who's a champion for this district and a public servant who has used his own personal experience with diabetes to advocate for broad-based change. As well as Kathy Rowe, a powerful force for good as the Executive Director of New Jersey Advocates for Aging Well. Dr. David Bleich, Dr. David Bleich, got to get the doctor's name right. A diabetes expert and the director of University Hospital's Endocrinology Division, and Mr. Joseph Werbeck, a local resident and patient of the diabetes clinic here who knows firsthand how these savings will benefit New Jerseyans like him. So thank you all for joining us. Thank you for sharing your story soon. Let me start by recognizing Ed Jimenez and University Hospital. Since its founding in 1882, this landmark of New Jersey has been our state's premier medical teaching and research facility. It's been the place where every resident, no matter their economic status, can obtain care. And as the Garden State's only public hospital, it has a mandate to provide this essential care and does a tremendous job of doing that. Just as Congress has a mandate to bring down costs for our nation's most vulnerable residents. Last year, as part of the historic Inflation Reduction Act, Democrats in Congress capped the cost of insulin for seniors on Medicare at just $35 a month. I say Democrats because we fought tooth and nail to enact this common sense measure. In fact, we had a measure in place to cap the cost of insulin for all patients, whether they were on Medicare or not, for every American, regardless of their insurance, but only to have it struck down by obstructionist colleagues at the last minute. Shame on them for their vote. And shame on them for denying these savings to hardworking Americans. But despite this setback, we as Democrats are continuing to fight. We're continuing to advocate for every patient, for every beneficiary, so that no American is ever gouged by the price of insulin again. After all, an insulin cap is not only common sense, it's clear that it's good business sense as well. Thanks to the historic action that Congress took on insulin, manufacturers are feeling the pressure to lower their prices. Just a few weeks ago, one of the largest manufacturers of insulin in the United States, announced they would reduce prices of commonly prescribed insulins, effectively building upon what we did in Congress by capping patient out-of-pocket costs at $35 or less per month. This is the difference for some people between life and death. It's one of the clearest examples of the power of good governance. And here we are today because Congress must ensure that every single person can afford this medication. That means capping the cost of insulin for all patients. It should not matter whether you have Medicare or private health insurance. It should not matter whether you are 6, 16, or 65. Insulin should be affordable for every American. Why? Because insulin is life-saving medicine for diabetic patients. For families all across New Jersey, it is as essential to them as keeping a roof over their heads, putting food on the table, and other costs of living. In many ways, insulin is their cost of living. So why in the world do we see that it is unaffordable and out of reach for so many patients across the country? How could it be that we are in a world where patients have no choice but to ration it, or worse, go without it, just to make ends meet? So I refuse to accept a reality where Americans have to make this impossible choice. No one, and I mean no one, should have to choose between their prescription and providing for their families. No one should have to delay their retirement because they can't keep up with the rising costs of life-saving medications. And no one on Medicare should have to see a larger share of their fixed income go towards out-of-pocket expenses. Which is why I included a provision that is now law in the Inflation Reduction Act that limits out-of-pocket expenses for seniors to $2,000 a year, on top of additional provisions that will allow them to spread the costs over affordable monthly payments. That's a life-changing reality for patients. Thanks to my provision, instead of paying upwards of $7,000 a year, which was the reality before the new law, starting in 2025, they will have peace of mind knowing that treatment costs are capped at a fraction of that. This crucial out-of-pocket provision for Medicare, combined with an insulin cap for seniors, stand as two of the landmark accomplishments that Democrats achieved in the Inflation Reduction Act last Congress. I was proud to vote for them, and I am proud to support them now. I am especially proud because today we can finally declare that seniors have access to affordable insulin thanks to the work that was done by Democrats in Congress. This is the gold standard of legislation, where we can draw a clear line between the actions we take in Washington and the benefits to communities that need it the most. Now we need to finish the job and cap the cost of insulin for everyone who needs it. And with that, let me bring up someone who has been a champion in this regard, an ally in the House on these issues, Congressman Donald Payne.
Thank you. Good morning.
Good morning.
First, let me thank Senator Menendez for the invitation to speak with you here today, and just express my gratitude to him for the leadership that he has demonstrated as the senior member in the Senate for New Jersey on so many issues. But as he stated, this one is very personal for me today, so I personally thank him for the work that he's done in the Senate. Lowering the price of insulin is a top priority of mine. As a diabetic, I know the high cost of insulin affects 37 million Americans with this condition. Diabetes is the most expensive chronic health condition in our country. The monthly average cost of it can be almost $650. That is 10 times higher than the price of the same amount in other countries. But there have been efforts to lower that cost. Right now, the Inflation Reduction Act has established a $35 cap on a month's supply of insulin for Medicare beneficiaries. And as the senator stated, that was hard fought for us to even keep that. And to those who might think we're being partisan about this, all you have to do is go and check the vote and see who voted with the American people and who didn't. Senator Menendez co-sponsored the Affordable Insulin Now Act in the Senate. And this bill would cap out-of-pocket costs for insulin to that same $35 for all Americans. And President Biden's recent budget proposal includes that same $35 insulin price cap. If we can cap payments, we can help more than 208,000 diabetics in Essex, Hudson, and Union counties afford this life-saving medication. In addition, it helps African Americans the most because they are more likely to develop diabetes than our white counterparts. And I am pleased to see insulin makers lowering the prices of insulin already. They finally got the idea. But we need to raise more awareness of the need for lower insulin prices across the country. And I'm proud to join Senator Menendez at this event to create that awareness. We need to make insulin affordable so diabetics do not have to ration it to survive. No one should ever have to choose between insulin and the food in this country. And I'll just end with a personal experience of mine. Traveling back and forth between Washington and Newark, I left my insulin in Newark one day on my way to Washington. And so I went to the drugstore that we use, and they said, well, okay, Mr. Payne, but your insurance isn't ready to cover it, but you know, I'm doing all right. And so I said, well, I'll just pay for it, it's okay. So the young lady goes and gets the package and comes back and she tells me, and this wasn't for a whole month's supply, it was just a parcel, $357. And my mouth dropped open. Because I have insurance, I did not know the cost of what insulin was. And at that time, it triggered my mind in thinking, my God, what do working class Americans do every month to afford this? And so I became a staunch supporter of the legislation that Senator Menendez has proposed. And it is a matter of life and death. And it's unfortunate that the companies that produce this would charge so much for it when they know it's life and death. So they know you don't have a choice, which is very troubling. So I'm just delighted that we've gotten to this point. It's been a hard, long fight, but with leaders such as Senator Menendez in the Senate and the work we've done in the House, we've finally won for the American people. And with that, I'll just say thank you once again, Senator.
Thank you, Thank you, Congressman. Now Dr. David Blythe of University Hospital.
I'd like to start by saying, Senator Menendez, thank you. I have waited a long time for this. As a healthcare provider and diabetologist, it's incredible to have a treatment plan for a patient undermined by the inability to pay for insulin. Diabetes is a very unique disease in one regard, that it's 24/7, 365 days a year. It doesn't decide to let you go on vacation. It doesn't decide to say, okay, it's party time, go and have whatever you want, have drinks, have pizza, have fun. It's there, and the patient has the obligation or not to take care of him or herself. What's incomprehensible is to think that they can't get their medication, especially when it is insulin. And as has been said already by our esteemed congressman, insulin is absolutely life-saving. It prevents people from hospitalization. It prevents patients who have diabetes from severe complications of the eyes, of the kidneys, of the nerves. Myriad types of bad things happen when blood sugar isn't controlled. So this really is landmark, groundbreaking. I know it's a beginning because there's still work to do, but I applaud our Democratic senators and congressmen who pushed hard to get this insulin cost reduction put in place. Thank you.
Thank you. Thank you very much. Kathy Rowe, Executive Director of New Jersey Association for Aging Well. Is that right? Okay, all right. I'm all for aging well.
Thank you. Thank you for having me here today. And on behalf of the 1.9 million people in the U.S. with type 1 diabetes, I want to thank you and the congressman for your work in getting this important act passed. I just want to take a second to make it clear who and what we're talking about, because there is confusion sometimes over the two types of diabetes. There are two types, and the majority of people have type 2 diabetes, which has multiple factors and treatment options. It can present differently in different people at different ages, and you probably see several ads on TV every day for our new type 2 diabetes medication. Type 1 diabetes has one cause. People cannot make enough or any insulin, and that's what regulates your blood sugar. The one and only way to treat type 1 diabetes is with insulin. That is it. It used to be known as juvenile diabetes because the majority of people were children when diagnosed. Now diagnosis comes at any age, and people with type 1 diabetes are living longer and healthier lives than ever. Through the last 40 years, we've had many life-changing improvements in the treatment and care for diabetes. There's home blood testing, continuous glucose monitoring alongside improvements in the production and purity of insulin. There are several delivery methods with syringes, pens, and insulin pumps. But all of this progress that has been made, one thing remains the same. Until there is a cure, the only way to treat type 1 diabetes is with insulin. And we have all heard stories about senior citizens who cannot afford their medications, and they struggle between balancing the cost of medicine, food, and housing. That should not be the case for senior citizens in the United States, especially not when the doctor who discovered insulin over 100 years ago made it his priority for it to be accessible and affordable for everyone. It is one problem when there is no treatment for a disease. It's another problem when there is a treatment and it's sitting on the refrigerator shelf in your local pharmacy and you can't afford to pay for it. The passage of this act will help not only people living with diabetes. According to the American Diabetes Association, diagnosed diabetes, both type 1 and 2, cost an estimated $9.2 billion in New Jersey alone each year. This cost falls on individuals, on private insurance, on Medicare and Medicaid. The price cap will reduce costs to health systems overall by helping people manage their health and avoiding costly emergency room visits, hospitalizations, and complications. In my work at New Jersey Advocates for Aging Well, I've heard countless stories from seniors about how often they face the difficult decisions on what to pay for, their medication, their food, their housing, or other necessities. I've also heard from them how grateful they are for this legislation and how it's going to make a huge impact on their quality of life. But for me, this is not just a professional matter, this is also a personal victory. When I was diagnosed with type 1 diabetes in 1978, Medicare was still a rather young and new program, and the life expectancy for people with diabetes was 25 to 35 years, with a high probability of complications as we aged and went forward. So I know how important this is to each of us living every single day of our lives with diabetes. As you said, there's no day off, there's no vacation, there's no way to take a break. So I know how important this is, and Senator Menendez and Congressman Payne, I want to thank you on behalf of type 1 diabetics everywhere for this legislation and the work you're doing to cap insulin at $35 a month for all Americans. I hope soon that your efforts to make insulin affordable for everyone becomes the law of the land. Thank you.
Well, I asked my staff, I said, we need someone who actually is a diabetic and knows the real-life consequences of this. Then we had Congressman Payne, we had Kathy, which I was unaware of, but now we have Joseph Warbeck, who's a patient here at the hospital diabetes unit. Mr. Warbeck, thank you. Oh.
Good afternoon, everyone.
Good afternoon.
I want to also thank also all the diabetics, to the senators, for doing this possible for us, because it's very important. I remember, I've been a diabetic my whole life, And I remember when I couldn't, or my family at that time couldn't afford to go buy insulin. I used to, I could not have eat all day. It was sometimes 2 or 3 days because I couldn't afford the insulin and I had to keep my sugar below. I say, I'm thankful. I didn't think this day was ever going to come. And I thank you to the senators and staff here that thank you. Really thank you, because it made a big difference in my life. And I'm more healthier now than I was back then when I had to struggle to get the insulin. And I just say thank you, because there's a lot of diabetics. They would understand exactly what I'm talking about when you can't afford the insulin. And like the senator said, this is a life-saving medicine. It's like, it's not a choice. You know, it's what we got born into, and we have to deal. And I'm glad the senators, they realize these things, and they're making it much, much, much better for us. Thank you.
Thank you very much. All right, thank you very much. Before we just open up to on-topic questions, as I see our friends in the Hispanic press here, let me briefly say, estamos aquí reunidos hoy, el congresista Payne, yo, el hospital, University Hospital, y los asociados aquí, promoviendo, dando conocimiento de una ley que pasamos que limita el costo de la insulina a esos que están en Medicare, $15 al mes. Es enormemente beneficioso porque puede costar cientos de dólares. Ahora queremos que esa misma limitación sea la realidad para todos los diabéticos en el país, que le hace falta esta medicinita, que es una medicina de vida o muerte, y cuentas cientos de dólares. No hay razón por qué no podemos limitar el costo de esta medicina, que ha existido por mucho más de un siglo, a ese límite de $15, para que personas no tengan que decidir entre su comida, su casa, su bienestar y tener la medicina que es importante para su vida. Así que estamos contentos de que la ley que existe limita esta realidad para todos los que están en Medicare, pero queremos que sea esa la realidad para todas otras personas que no están en Medicare, que quizás tienen seguro o otro tipo de procesos de conseguir su salud, que también tengan esta misma limitación.